The silent killer. Do you know what it is? Hypertension or high blood pressure. Can it kill you and cause you death? Absolutely it can. Stay tuned, and I'm going to go over the causes, symptoms, and some risks that you have with high blood pressure, and also some things you can do to help with that so you don't suffer the consequences. I just had personal experience with one in my family. Stay tuned. So why is high blood pressure or hypertension known as a silent killer? Well, with a lot of people, they don't have any signs or symptoms. And so next thing you know, something happens and they can have a stroke, which is what recently happened to somebody in my family, and which is why I think this is so important to talk about, more so now than ever, because of things that we do, like eating processed foods and other things that we do. Blood pressure is measured with a top number and a bottom number, systolic and diastolic. And the top number is when the heart beats, and that's the pressure in the arteries. And then the bottom number, the diastolic, is when it rests, and that's the pressure within the arteries. And so it used to be like 140 over 90 or 140 over 80. They would consider hypertension. But the numbers have changed because there's an increase in cardiovascular disease, kidney disease, strokes, and things like that. So a well-known cardiologist, I watched him be interviewed, and of course I've read a lot of data and research, and really the numbers need to be closer to 120 over 80. Now I know people are different. Some people run 90 over 50. When I worked in the ICU units, there was a thing that measured with like an arterial line, or if you've got an automatic blood pressure cuff and it gives you the top bottom number and then it gives you a number in parentheses, that's called the mean arterial pressure. That pressure has to be 60 or greater, or you're not perfusing. Blood is not going up to the brain through the carotid arteries. It's not going out the aorta. It's not getting into the lungs. It's not getting to the kidneys. So that's one way you can do it. But other than that, it should be closer to 120 over 80. There's research that shows that if you can lower that top number, the systolic, 5 millimeters of mercury, which is what blood pressure is measured in, it will actually decrease your risk of heart attacks, an MI, or a stroke by 10 to 15%, which is huge. So there's things that you can do to decrease your blood pressure, and we're going to get into that in just a minute. So as far as symptoms, you may not see any symptoms, and that is why it's called the silent killer. And usually by the time symptoms appear, it's at a critical stage. And you can have such things as headaches. You can see people with their face right through here. It'll get red, they'll flush, shortness of breath, some dizziness, things like that. Another symptom that people have that have high blood pressure, and it might not even be related to that, but it could be, is if you have nosebleeds. So if you have frequent nosebleeds, it might be something, if you haven't been checking your blood pressure, you start checking your blood pressure. There are symptoms, but they're usually late signs that you're having hypertension or high blood pressure. So it's really good to get a blood pressure monitoring system at home. There are some, with my parents, we got through their cardiologist, because one of them has a extra beat and goes into AFib sometimes, or they'll throw what you might have heard of PVCs or PACs. Those are premature atrial contractions or premature ventricular contractions. And so what'll happen, the cuff will puff up, and as it goes up, it'll stop and it'll reset and pump up again. You're never going to get an accurate reading that way. The number is always going to be too high. It's not going to be accurate. So if you can't use a manual cuff with a stethoscope, which is the best way to go, see if you can get one of those type of monitors. And if you've got hypertension or any heart issues, you should be able to get it through your cardiologist. They could probably write a prescription and you can pick it up somewhere or order it for you, and insurance should pay for it. I know they paid for it for my parents. Another thing about taking your blood pressure is do not use the wrist, the blood pressure cuffs that you can put on your wrist and they take your blood pressure. The blood pressure, the further away from the heart, the higher the blood pressure is going to be. When I say they're not accurate, they're accurate for where you're taking them. I've seen people take blood pressures in the legs. It's going to be higher. So if you did that because you couldn't take it, say you had a mastectomy, a bilateral mastectomy, and you couldn't put a cuff on either arm, if you did do it on your leg, then document which leg that you took the blood pressure on. So if you can't take it the way you normally take it, and you take it in a different part of the body, document what your blood pressure is. Always do the time and date, and then the location that you took it. But they don't recommend wrist blood pressure monitoring. I go to a dentist and she does it by the wrist. The only reason she does is because she says that she's going to give you a medication. She doesn't even really care what it is. But if something changes, and it does sometimes, and they've had to call 911 with people, then when they take it again, at least they had a baseline before they gave you that medication. So that's another thing a lot of people don't think about. My brother had one. He was diabetic, and he used the wrist one all the time. And I told him, Kenny, don't use that one. Get an automatic one. Get one from your cardiologist. Since you have heart issues, and you could probably get it for free and your insurance will pay for it. But anyway, I wanted to add that in there because it's really important. The other thing is that cardiologists and regular primary care physicians are now saying that they're not even treating the blood pressures they're getting in the doctor's office. The reason is because most people, when they go to get their blood pressure taken at a doctor's office, they're already stressed over going, what's going to happen? What are they going to say? Is there anything wrong with me? And so they get a little anxious and apprehensive before they go. So doctors now are telling me we are not treating pressures that we have in the office. What we want patients to do is we want them to take their blood pressures at home. If they're on a blood pressure medication, they should take it every single day, usually around the same time. Bring the figures to us, which is what I do when I take my parents to their doctor's appointments, no matter whether it's primary care, endocrinology, cardiology, it doesn't matter. And then they have a list and it's documented. So it's better to take your blood pressure at home. If you don't have hypertension that's already been diagnosed, I suggest taking it really once a week. Because you never know, circumstances change. We're all under more stress lately with things that are going on. And so you could develop it at any time. So some causes of high blood pressure are an unhealthy diet and eating processed foods. Some resources say that your diet should be low in sodium. On the contrary, the research shows that actually a low sodium in your blood, your electrolytes, potassium, sodium, magnesium, those things, that actually people that have lower sodium counts have hypertension. And actually, my mother is one of those. When her sodium drops, her blood pressure goes up. So I think it's too controversial for me to say that your diet should be low in sodium. Now, if you have kidney issues and you're seeing a nephrologist or something like that, you have to be careful from all the electrolytes. But other than that, salt should not be an issue. Lack of exercise, and I'll go over more details about that in just a minute. Obesity, if you smoke or vape or do other things that involve smoking. Stress is another big one. Lack of sleep. If you have diabetes, all those things can be causes of hypertension. So let me go into the exercise component of it. So now the studies are showing that exercise, that really we need vigorous exercise of about 150 minutes a week. So that's 2.5 hours a week. Now, obviously, if you haven't been exercising, always you want to check with your doctor. You want to start slower. You want to start at a lower pace. You want to maybe do 5 minutes at a time or up to 10 minutes at a time and do a little bit each day until you can build up to a total of 150 minutes a week, because that's what they're recommending. When I was talking about nutrition and a healthy, I hate to say the word diet, but healthy nutrition and how you eat, and and I was speaking about the sodium, I've got a video right here, and it's basically specific to type O blood types, because that's the most common, and it tells you about all the different highly beneficial, like medication for your body, but it's food, and then there's the neutral, you can eat what you want, and then there's the void, which is like poison to your body. So I suggest, if you have time, to go and look at that video. And I seem to do really well on type O when I eat according to that. And it's not a diet, it's not eliminating things. I'll give you an example. I can eat spinach, but I can't eat corn, and it's just the way our DNA metabolizes it based on our blood type. So another obvious thing is smoking or vaping. And what it does, it constricts the blood vessels. And when you constrict the blood vessel, just think of a hose. If you got a hose this big and you're running water through it, what the pressure will be. You constrict it smaller, and that's a smaller diameter, it's going to push that pressure up. And if there's any plaque or anything in the arteries, maybe you had an injury and damage, and there's something that built there to protect that artery, pieces can actually break off. And depending on what location they go to the heart, it's a heart attack. If they go to the brain, it's a stroke. So smoking and vaping should be out. The other thing is alcohol consumption. Now, it depends on what country you live in, believe it or not. I've seen studies in America, and they say really no alcohol consumption is good for high blood pressure. Maybe it's because of things that go along with it if you indulge in it too much. In Canada, the recommendations is 2 drinks per week, and they're saying it's okay for that. But the doctor that they interviewed out of Canada, he disagrees, and he said really there's no benefit for alcohol consumption. You think that it will, help you sleep better, which is another factor in high blood pressure, is not getting enough sleep. The studies show 8 hours a day. So sleeping is really important, because when we go to sleep, a lot of times we should go into the REM type of sleep, and that's where we can dream, and we're really into a deep sleep, and our body actually heals itself. So it relaxes, it heals itself. It's like our recovery time is sleep. And so when I was talking about alcohol consumption, people think that it actually helps with sleep, but it does not. It hinders sleep. There's a really good book out called Why We Sleep, and I'll put a link in below, or any links that relate to anything I'm speaking about in the video that you can look at and see. So another thing is managing stress. Now, I did another video about stress, and that video is here. It actually talks about how stress we can benefit from it, but not continuous ongoing stress. No. So it's how we react to it, what our perspective is of it. And in that video, it talks about things like forest bathing and meditation and walking and all those things. Walking is very beneficial. When people think exercise, going back to the exercise thing, and I know I'm backtracking a little bit, but it doesn't have to be weightlifting and anything that's going to cause harm. I know there's people with back injuries and neck injuries and other type things, but briskly walking 20 minutes a day, you just don't know what it does to you. It's so healthy. You're out in nature. Hopefully you're in a place where you're breathing fresh air, and that movement of the arms and the legs, the way they do like a baby crawling, it's so good for the neurotransmitters and the neuropathways in our brain, and it's just good overall for everything. So get out in nature and take a walk. So another thing you can do, and if you have the time it takes and the money it takes to take care of an animal, dogs are probably like the #1 animal they suggest, because you have to get up, you have to take the dog out, you have to go for walks and all of that. They were also speaking of, say the dog does something in the house that's not what they should be doing, and then of course that would cause stress. But overall speaking, I mean, any of us that have animals, I have a cat now. I used to have horses and a donkey, and I've had dogs. But at this stage, with everything else going on, I have a cat. They're definitely soothing. Just loving them and their unconditional love really help with stress management, with just everything. You know, you want to take care of yourself so you can take care of your family, you can take care of your animals. And so having an animal, whether it be a dog, cat, donkey, horse, whatever, all those things, you know, help. And it helps with the stress, which helps with the constriction of the arteries and having the hypertension. So you want to do everything you can that's healthy to prevent having high blood pressure. Going back to the doctors and all the research that's being done, and they're saying we're not going to go by what the blood pressure is in the office. We want you to take your blood pressure at home. Then when you come to the office, we'll look at your list. They are all saying now, that are the ones that I know and the ones I've researched, that the first thing they want you to change is your lifestyle. So all the things we're talking about, like eating healthy and not smoking and limiting your drinks if you live in Canada, but you know, if you live here, you're not supposed to drink. I don't get that one. But anyway, alcohol in moderation. But lifestyle changes first. They're not even going to put anybody on a blood pressure medicine. And I'm sure if it was something that was really excessive, of course they would, because they wouldn't want you to have a stroke or heart attack. But they're saying basically that they want you to have lifestyle modification, because that is one of the main things that causes hypertension. So it's good to know they're on board with, you know, not handing out prescriptions. So another thing that goes along with healthy lifestyle is, if we have that, we're usually not overweight or obese. Obesity is running rampant, especially in America. And I'm going to list a body mass index chart here, and that's thunder and lightning. So anyway, you really need, your BMI needs to be less than 25. Greater than 18 and less than 25. If it's less than 18, that's still unhealthy. So people think if they're thin, that that's healthy. I know a lot of thin people that are very ill. So there is a, you know, too low of a BMI, too high of a BMI, you know, extreme to both, to get into the middle of 18 and less than 25. Another question that was asked is, well, what about my age? You know, we're told that people that are over 60 or over 65 are now, you know, they're saying that, you know, elderly is greater than 55 years of age, which I totally disagree with. But there is there's no difference. It doesn't matter what your age is, as far as, you know, an adult. Children, that their pressures are a little bit different, and infants and babies are definitely different. But overall, there is no differentiation for a certain age group. 120 over 80 is the gold standard. Does our blood pressure fluctuate up and down from time to time with situations? Of course it does, and that's actually a sign of a healthy heart. But you don't want it to be too high, because that's bad for your body systems, which, you know, your heart, your lungs, your kidneys, your brain. You have to have a certain amount of pressure, and you don't want it too low, because it causes the same problems, except, you know, you're less likely to have a stroke or a heart attack with a lower blood pressure than a higher one. But kidney failure and things like that, you've got to have a certain amount of pressure going to certain organs. So how do you prevent it? Well, all the things that I discussed about what causes hypertension: poor diet. So what do? You eat better. And I believe in eating according to your blood type. Do I do it 100% of the time? Absolutely not. But I do it a lot, and I feel much better when I do. Exercise, absolutely, you have to exercise. Like I said, if you can just walk briskly 20 minutes a day, is fantastic for your body. It helps you deal with stress better, which is another issue. It helps you with sleep when you're more active. If you're just sedentary, you usually don't sleep well, and you're going to put on weight, and you're not going to handle stress real well. So all those things, you know, eating right, getting enough sleep, exercising, not smoking, not drinking in excess, and those type things will really help maintain a good blood pressure. And please, 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 whatever you do, take your blood pressure on a regular basis. And if you are on medications, which I'm going to talk about medications in another video, because my mom just had a stroke due to hypertension, and she's had hypertension for a long time. And something with a medication, and it was the same medication, but I want to do a video about medications and about what the amount of the active ingredient has to be in them that's required by the FDA. Well, just a little bonus, a preview of the video was this: there is no standard. It's whatever the drug company thinks, but I want to do a whole video on that. So anyway, I hope this helps, and just stay aware, watch your blood pressure, do all these things, and stay healthy, and prevent yourself from having a heart attack or stroke due to hypertension. Because I can tell you, coming back from mom's stroke a couple weeks ago, it's been, rough. We're doing very well, and thank you all for your prayers that know me personally. But we got a road ahead of us too. We've got to have some surgery, vascular surgery, bypass on her leg due to hypertension. So there's just a lot of things that it can cause, and just want people to take care of themselves. If you have any questions, and if there's a way that you can control your blood pressure, means that you do it, leave it in the comments below so others can see, what do you do to control your blood pressure? And I know there's herbs and there's essential oils out there and all that, and I'm going to get into that, but that's going to be another video as well. So anyway, thank you for watching. This is Nurse Kathleen. Have a great day.